We're good. We're traveling. I'm always wondering, are you commando still? Or are you really Cobra? What are you doing over there? It goes all over the world, that post-transplant.
Well, to follow that, geez, okay. My name is Heidi Parnbarker. I have some Allen bullets here so I don't miss anything, but I was diagnosed with cystic fibrosis when I was 18 months old. I was gonna say this is a genetic disease, but I heard you learning about CF and some of the airway clearance before we came in. But I led a relatively normal childhood until my freshman year of high school. And I can't remember exactly why, but my lung functions started to deteriorate. And my doctor at Children's Mercy at the time said, okay, we need to admit you for what my family and I decided to call tune-ups, which I would go into the hospital for 2 weeks at a time, receive antibiotics, and then leave and resume my life. But I did that, these tune-ups, every 6 months until the time of my transplant. So that was in 1996 when I was hospitalized for the first time. And I was able to go to college, and I got married, and I remember my doctor at the time thinking that these were such accomplishments. And for me to hear that, because CF patients, they're not really encouraged to be close because of the ability to transmit our bugs to one another. So at the time, it was hard for me to know anybody else and to compare myself to anybody else with CF. But when I got married, my FEV1 on my lung function was 24%, and I still felt like that was fine, because for me it was all relative. That's all I ever knew. And because my lung function deteriorated so slowly, it wasn't like I could say, you know, I felt awful, because again, it was all relative. I didn't know anything else. But we were married in 2006. Sorry. 2006.
I was like, I think I remember.
Right. And then a year later, not just a year later, my lung function again had dropped. And with CF, that's just part of the game. There's no real rhyme or reason. And it also isn't good to compare oneself to another person with CF, because everybody's disease is different, which is also what makes it so challenging. I'm sure as a doctor to try to figure out what works best for one patient compared to another. And so we went for evaluation at Barnes-Jewish in the summer of 2007, in July. And at that time they said, well, talking about quality of life, like Dr. Stites mentioned, you're still able to do most of the things you want to do. I was still working part-time. I would go to work, I would come home, I would sleep all afternoon, and then I would get up and do it again the next day. And again, that still seemed to me like I didn't have any problems with how my life was going at that time. But then by November, my lung function had dropped to, my FEV1 was 19%. And that's pretty low. And we made the decision to go back over to Barnes for a second evaluation. And at that time they said, you need to be on the list now. And so we moved to St. Louis, and my mom and my husband alternated every 2 weeks staying with me until I received the call that lungs were ready. And fortunately, I didn't have to wait that long. It was less than a month. And looking back now, I can say, oh my goodness, that was close. That was really close. And as Dr. Stites also mentioned, the surgeon, Dr. Patterson, one of the best at Barnes, said that it was really difficult to get my CF lungs out. Because for me, one of my major problems was inflammation, and so they were very sticky, and the inflammation it made them very difficult to remove. And I was put on a bypass. I don't remember how long the surgery took, but I might be able to answer that. Because I woke up the next day, and as Jean mentioned, one of the first things my parents noticed was that my toenails were pink. Like I had an experience that's etched in my mind. I was a bridesmaid for one of my friend's weddings, and we went to get pedicures and manicures, and they decided to get a French manicure on our toenails. And so for me, they started to paint that white tip over the top, and my toenail was kind of weird, kind of purple, like this screen back here. And so I said, could you just paint some pink and then the white tip over it? And so to hear my mom say afterwards, to see my toenails in ICU, they were pink, was a really big deal. And that first breath that I took, once they took the, it was a trach out, was amazing. It was amazing. And I still, even now, my lung function is around 50%. It's been there for like maybe 2 or 3 years. It's still better than I ever had with CF. Sorry. So, going back to my bullet points so I don't miss anything. So I have had some chronic rejection. They treated it first with thymoglobulin, which I think has to do with a rabbit serum, but it addresses the cells and kind of changes the cell makeup so that hopefully the cells quit attacking your lungs. And that did its job for a few years, but then my lung function kind of started to drop without any real cause, which they again call chronic rejection. And so I started photopheresis treatments in November 2015. And the photopheresis, we don't know exactly how it works, but it takes the blood out, and with ultraviolet light, kind of, I think, addresses the T cells. Okay.
You're right.
Doing great. And again, tries to make it so that those cells quit attacking my donor lungs. And that has worked pretty well for me. I still continue to do photopheresis. When I started, they had me do it twice a month. You have to do it on back-to-back days. And there's been a couple times when we've either increased or decreased how often I do photopheresis. But it is something I would definitely, if someone asked me if I would do it again, yes. Because without it, I don't know if my lung function would have continued to drop or what might have happened in that case. I will also reiterate, when he was speaking, I kept thinking he's talking about exactly what I wrote down. But that for me, having cystic fibrosis, it was like trading one disease for another. A person with CF takes so many pills a day. Like I've had people say to me, like I take maybe 20 pills at a time, which is one goal. And they say, how do you do that? Well, it's a lifetime of doing that. It's not a big deal to me. It's not a big deal to someone with CF to just drop them back. But I would also say that I will always champion getting a lung transplant because it is such a life-changing thing. Like for me, the alternative is I would be dead, So, doing the photopheresis, taking the pills, dealing with the diabetes that came with it, all those things you mentioned, I was like, yeah, I got those. That's pretty much me. It's all been worth it. And when I was asking Dr. Stites and Joyce what I should talk about, they also mentioned if I had any advice for you guys to share. And I asked Brad what his opinion was, and he immediately said, again, one of the things that Dr. Stites mentioned is to work as a team. And I think that will benefit you guys, but it will also benefit me as the patient, because there have been times when I've been hospitalized for a tune-up, and I'll talk with Dr. Stites for 20 minutes, and we'll develop a plan, and he'll leave, and then an endocrine doctor will come in, and he will completely change that plan. And my doctors are the best. They're the absolute best. And it's frustrating for me because it's like, but I was a part of that plan we just developed a second ago, and you're changing it to something new, and you haven't talked to one another. And so then for me, like, that changes my whole day, and I have to wait till the next day till someone comes back in because they've gone along with their day, they're doing other things, which I understand. But for me, it's like I'm sitting there waiting to hear what the new plan is, because they've moved on. You guys are dealing with other patients as well. And I know that my history is very complicated. So for you guys to be able to talk to either your teammates and also the other, I don't know what you call it, departments, endocrine, cardiac, pulmonology, just please all work together, because that's only going to help us and I think help you learn and know what's better for the next person as well.